Hi everybody, welcome back. Thank you for your patience. I am connecting with Dr. Eissler from IVF Life. We've just spoken and she should hopefully be here any second. A few technical issues, but we should be good. So we're going to be talking all about IVF stimulation length. So how long do different people stimulate for? Why is there a difference in stimulation time and process and different protocols? Talking about OHSS and the concern around that. Now, if Instagram works for us. Hi to those who are joining. There we go. Hello.
Hello.
Good evening. It's so nice to see you.
Good evening. Nice to see you.
Please.
Sorry for the technical problems.
No problem. And hi to those who are joining. Welcome back. Thank you for your patience. I would love for you to introduce yourself, please, and also IVF Life and Spain. And then we're going to talk about the all-important topic of different protocols, IVF stimulation length, and how it can vary from patient to patient, and I presume from cycle to cycle. So yes, please do introduce yourself.
Hello, everybody. My name is Dr. Alexandra Eissler. I'm a gynecologist and specialized on reproductive medicine, and I'm working in Alicante in Spain in IVF Life Alicante. And yeah, we have a few clinics in Alicante. It's the main clinic. We are a clinic for reproductive medicine, fertility, and we do a lot of IVF cycles and also egg donation cycles. And yeah, I'm happy to be here
Great.
today to have the possibility to talk to you and to answer your questions.
We've already had some great questions come through, so I'm going to save those shortly, so please bear with us for those who are watching, and we will definitely get to them. First of all, how does IVF stimulation work for those who don't know or those who might be new to it? What are the steps?
IVF stimulation means that we are stimulating the follicles that normally are offered every cycle from your ovaries. So every cycle your body is offering follicles, and normally only one of them will grow and go for the ovulation. But in case of stimulating in an IVF cycle, we give you hormones, or you are injecting the hormones by yourself, because we want all of the follicles to grow in the cycle and to develop oocytes. And once they are raped, once they are mature, we're going for the puncture, and we do an aspiration. We aspirate the liquid in the follicles, and in this liquid there are the oocytes. And normally this is a procedure of 2 weeks of stimulation, more or less, and in the last week of the 2 weeks is the puncture.
Mm-hmm. Would you expect to see an egg inside every follicle?
No. Hopefully there are the eggs in the most possible number of follicles, but it's totally normal that there are also follicles that don't obtain any egg, or only immature eggs, because not every cycle is synchronized. Not every follicle has the same size than the others. So it's completely normal that there are always 1, 2, 3 smaller ones, and they are not mature yet. So we have to select the best moment to go for the aspiration, for the puncture, to get the best number and also to get best quality of oocytes, of eggs.
It's a balancing act, isn't it, for you as a specialist team, because you want the smaller follicles to sort of catch up and grow, but you want to make sure that the patient isn't at danger of OHSS or the bigger follicles getting too big. Is that right?
Exactly. So it's very, in the end, it's very specific monitoring of the follicles, to check them every second day, every day, maybe. To make sure that we don't miss the best moment, but we also don't we don't want to wait too long, but we also, as you said, we also don't want to go for the puncture too early. So we have to pass the best moment.
Do you think the age impacts how long someone is stimulating for?
Honestly, from experience, I can say that's not the case. So a stimulation time is not depending on the age.
Yeah.
It's depending on, of course, the outcome of the stimulation is depending on the age.
Yeah.
But the time, how long the stimulation takes, is not depending on the age.
Okay.
On the age.
And what is the average timeline for stimulation?
The average time for stimulation is about 10 days plus minus 2 days. So more or less 2 weeks in total that we stimulate. And then the last days, it's depending on how fast the follicles are growing or not.
And if someone stimulates for, say, 14 days, is that a long time? Is that heard of?
I mean, a stimulation time is very individually. So we see in our patients the normal average time of about 10 to 12 days. But some patients, some follicles need a little bit more time for stimulation, and this is very individual, and it doesn't have to be a bad sign.
Yeah, that's really reassuring to know. Because I've had multiple egg retrievals at different stages in my 30s, and it's been interesting to see how 2 of the cycles I stimulated for exactly the same length of time, and then the most recent one was quite a bit longer.
Yeah, that's something we see often in our patients, that every cycle is a little bit different from the other cycle. So we cannot conclude from one cycle that the next cycle will be completely the same. So we have to see from cycle to cycle how things are going.
And why sometimes would patients stimulate for a little bit longer?
I mean, there's also one protocol what we are using. It's a long cycle protocol. But if we go for the normal stimulation protocol, we were talking about the 10 to 12 days. Of course, it might happen that the follicles are not growing fast enough. This can have different reasons, but in this case, we have to stimulate them a little bit longer. So this is one reason. But for example, if we go for the long stimulation protocol, then it's because there are some other issues. For example, it can be that the patient has endometriosis. It can be that the symmetrics of the follicles is not the best. So if the follicles are very asymmetric, we might consider to go for a long protocol of stimulation. And these are the 2 main reasons.
Okay, that's really good to know. We've had a question come in. Would you know why one round would be successful and another would not grow to the same size for retrieval?
Sorry, can you please repeat the question?
I believe the question is how cycles can vary. So why might some, be more successful with the amount of eggs retrieved, whereas another cycle may not give as many eggs?
Oh, this is because our body is not functioning every month the same way. So we are depending on a lot of factors from our environment, and also on a lot of factors from our own body hormonal production. So there are a lot of possibilities why a cycle can be different the next month. And of course, not all the oocytes are produced newly or every month. So we are born with the ovarian reserve, and the body is offering some of the oocytes every cycle. And not only every cycle, it's more like it's going in waves. So there are different time ranges when the body is offering new follicles, and we are interacting in these waves, and we are jumping on one of these waves, and we are giving some more hormones to get the best results out of the follicles. But this is not the same every cycle. So this is why we have different results. And
does it depend on seasons as well? Do some patients have different results dependent on the month?
Normally, it's not depending on the season, on the months.
Okay, that's really good to know. Someone just said thank you for that answer. So what are common symptoms when you're having stimulation during the stimulation phase?
So, of course, you're injecting hormones during a stimulation. So, this is giving some changes to your body. And this might be more present than one person, and the other person don't has any symptoms of the stimulation. But what I heard from my patients is that some of the hormones can make you feel a little bit more sad or deprimied. Normally, in the end of a stimulation, since the ovaries are growing, the follicles are growing, this is what we want. We want to make them grow. Mm-hmm. So they are becoming heavy, so you can feel them in your lower abdomen and your lower belly. And sometimes this is also causing kind of a pressure in the lower belly. Normally, it's not a kind of pain. It's more like a pressure. You feel there's happening something. Mm-hmm. So these are the most common side effects. And yeah, of course, the hormones can also make a little bit of tension or pain in the breast. But beside of this, there are not really side effects.
Mm-hmm. Yeah, no, that makes complete sense. What about duo stimulation? Please, could you explain a bit about that? Is it okay to do within the same menstruation cycle? Do you do that at IVF Life?
Yes, we do that at IVF Live. So the data, the data is not showing results that dual stimulation is better than single stimulation, but also the other way around. There's no evidence data that single stimulation is better than dual stim. So we can say they are more or less equal. And as I told you earlier, the body is offering, the ovaries are offering the follicle in special waves. So this is not corresponding to the months. So every cycle, you're on another wave of the ovocyte offering process. So what we are doing in a dual stimulation is that we do a normal stimulation, and after the egg retrieval, we jump on the next wave. Right. And what we can see that normally the second stimulation is taking a little bit longer in our patients. Mm-hmm. And from the outcome in our clinic, the results are more or less the same. So there's not a huge difference between a dual stim and two single stimulations.
So who would you recommend the duo stim for?
A dual stim I would recommend for persons who have to travel, for example, a long way to reach our clinic or to do the treatment. And for persons who don't have a lot of time. So if you are in time pressure or you cannot take off a lot of times because of your job, then it might be a good idea to do a stimulation. Then you can do the treatment a little bit more compact in a shorter time.
Okay, that's really good to know. If anyone hasn't got any questions around this, around everything we've been talking about to do with process and IVF stimulation and length, etc., please do head to our link in bio to speak to the team at IVF Life to talk about personal recommendations and situations. Could you tell us a little bit, we've talked about it a bit, but side effects of stimulation. Many people, and I've been there myself, have been fearful of OHSS, so overstimulation. How can that be avoided and monitored during the stim phase to reduce the risks?
Yes. Of course, hyperstimulation is one of the risks of a stimulation, but luckily it's not very common anymore. Okay. So there are a lot of possibilities to avoid hyperstimulation, for example, in a proper monitoring of the follicles and also of the hormones. Mm-hmm. And also, there are special medication that we can give to avoid hyperstimulation, so that we can directly after the egg retrieval we can lower all the hormone levels, so that the risk is really minimal to get a hyperstimulation. And that's why we luckily don't have a lot of hyperstimulation syndromes anymore. And that's very important also to monitor the follicles.
Mm-hmm. And if someone, what would be the symptoms of it for someone to look out for if there were side effects?
Hyperstimulation can have different symptoms. The first thing, of course, is pain in the belly, because during the hyperstimulation syndrome, there's some liquid going out of the blood vessels into the belly, and this is causing an irritation, and this is causing pain and nausea.
Yeah.
So these are the two main symptoms of hyperstimulation. And of course, if there's no treatment and of the hyperstimulation syndrome, there can occur other symptoms jumping on of them, but those are the first symptoms.
Yeah, no, that makes sense. Thank you for that. And in terms of follicles, how many follicles should people expect at the end of their stimulation for retrieval?
This is a very difficult question, because this is depending on a lot of things. This is depending on the age of the patient, and this is depending on the AMH level of on the ovarian reserve of the patient. And for this reason, I cannot give you a clear number or answer to this question. Of course, every patient has other expectations and levels, and we always try to get the best number, but you have to be careful. Not only the number of the follicles is important, also the quality.
Absolutely. So triggering at the right time to get the optimal results. So when patients come to see you, and please do head to our link in bio to book a free consult with the team at IVF Life. Do you give an indication of sort of what patients might be looking at in terms of numbers based on AMH level and an initial scan?
What we do with all our patients is that we measure the AMH level in the first visit if they come, because we have two possibilities. Patients can come for the first visit to our clinic, what is in my eyes the best option, because like this they can get known the people, the clinic, and we can do the scan directly by ourselves, so we can count the follicles by ourselves, and we have the AMH level directly so that we can discuss it. And the other option is that they do the first visit as a Skype visit, and in this case, of course, we have to rely on the results of your gynecologist at home, who is counting your follicles, who might not be a specialist in reproductive medicine. And we also have to wait sometimes for the AMH level. So I prefer a personal visit, but sometimes it's just not possible. That's why we offer also the Skype visit. And then, of course, when the patients are in our clinic, we do the scan. We count the follicles. Normally, we do also a transfer test in the first visit to see if there's any kind of obstacle, any kind of issue that we could solve with a little bit of time, of course. And then we are measuring the AMH level to give a good recommendation, but not to give a number, because it's we can suspect a number, but we cannot tell in advance the exact number.
Of course. We've had some really good questions. Do you mind if I ask you a couple before you go?
Of course.
Is it better to stim longer? Is it better to stim with lower medication and slower, or higher dose and faster?
This is, I would say, the golden middle pathway is the best. So it's not a good idea to stimulate over weeks, because you then you risk to lose follicles.
Mm-hmm.
But of course, in my eyes, it's also better to not to force a stimulation. I mean, not to go too fast into a stimulation, and also you have to consider how many follicles do you wanna feed with the hormones. How many follicles do you wanna grow? So if there's a high number of follicles, you need more hormones. If there's a low number of follicles, you need a little bit of less hormones, because you don't want to lower the quality of the follicle. It doesn't make sense to let the follicle grow, but in the end, they are all bad quality follicles.
Yeah, that makes complete sense. And how would a low AMH level affect a stimulation length? Would it be longer potentially?
It's not affecting the stimulation time. It's more affecting the outcome of the stimulation in terms of number of ovocytes that we can retrieve, and also in terms of quality of the ovocytes.
Okay.
So if the AMH level is lower, normally we get less ovocytes with a little bit lower quality as well.
Okay. That's useful to know. So please, anyone who's been joining today, Dr. Eissler and the team at IVF Life would be very happy to answer your questions with a free consultation. Please do follow our link in bio, and they are here on hand ready to help. Thank you so much for your time today. Thank you everyone who's joined, and appreciate the patience with connecting.
Thank you very much as well. And yes, we're in Alicante. We are happy to hear from you.
Absolutely. Thank you very much. Have a nice evening, everyone.
Bye-bye.
Bye-bye.